Okay guys, so this is Dr. Fragoso. I was just wanting to go over quickly how to do a SimChart submission for your clinical assignment that will be due each week. I am going to go pretty quickly, but I'm going to try to cover as much as I can in a short amount of time as possible. So if you have any questions, please feel free to reach out to myself or your individual clinical instructor. I started out with the main SimChart page, and for this example, I'm just going to go into the practice assignment. This is available to you, so please utilize this as much as possible to get as much practice as possible. You're going to come over here to practice assignment and my clinical, and when you open this tab, it's going to pop up this screen here where you're going to see it's kind of just a blank template of what you're going to be inputting every single week when you put in your patients into SimChart. This is rather long and time consuming. However, with time and practice, it will definitely get easier. So I'm going to just kind of make up examples here, nothing specific, and I'm just going to go through it rather quickly. So in order to move on to the next screen, you actually have to fill in all of these screens. Oops, that would have all of my info, so please don't copy that. And then you have to actually save it. And it's telling me here, please select an avatar. So it wants me to physically go in and pick something. So for this, I'm just going to pick this one and then hit save. Once it's saved successfully, it will bring you to the next screen. So I went ahead and created this chart for you guys. It's more of like a navigation, and it tells you where to go whenever you are looking for your information in Cerner, which is the clinical documentation system that Baycare uses. So SimChart navigation and required documentation, and this tells you kind of where you're going to be going in SimChart in bold, and then it tells you kind of what you're going to be using within that section. So to go back to our SimChart here, this is where you're going to be adding your main diagnoses in your preclinical manager right here. So your diagnosis, it wants you to add what the primary diagnosis is, and then you have to physically drop. It's like a drop-down box, and you have to pick something. So as you can see, it can get to be a little tedious. There's so many options to pick from. So if your patient has a specific diagnosis that isn't necessarily listed, then you can type in here and see if it pops up. If not, I believe there is another option for just like a free text. So for this example, I'm going to stick with myocardial infarction, and this is my primary diagnosis. Here you're expected to type in your pathophys. So just as an example, I'm just going to type in something quickly, death of heart muscle, and you can use your textbook and kind of go into more detail, but I like my students to use in their own words so that it helps you understand it a little bit better. Let's see here, we'll say from arteries, occlusion, and occlusion due to blood clot, we'll say. I'm just making this stuff up. I mean, I'm not making it up, but I'm just kind of going quickly just to show you. And then therapeutic regimen is what we would expect to use for a patient with a myocardial infarction. So obviously, we would want, depending on what the test was or was the test confirmed as far as diagnosis goes, then we would want, you know, blood thinners. I don't know. We'll just leave it at that for right now. But you can use your textbook, and there's literally a section that says what the therapeutic regimen is. For current health problems and related functional changes, this is where you're gonna find their other medical diagnoses. So a lot of the times the patients will have multiple comorbidities that are contributing to this primary diagnosis, such as hypertension, hyperlipidemia, diabetes. So those are some things that contribute to this diagnosis. Now, if the patient had asthma, or if the patient had, say, I don't know, anemia, that's not necessarily going to contribute to my primary diagnosis of MI. So I'm just picking the diagnoses that actually relate to this primary diagnosis. So here it's telling me that it was added, and that's my primary. For secondary, you're going to add the secondary diagnosis that is relative. So if the patient came in with chest pain and they were diagnosed with an MI, but they were diagnosed with, we'll say, a DVT, then, we'll go DVT here, deep vein thrombosis. That's my secondary diagnosis. And then your patho is going to be here, clot formation of the venous arteries. Again, I expect you to use your book, but I'm just kind of using stuff off the top of my head, so bear with me. And then therapeutic regimen, anticoagulation, and then there's probably going to be a heck of a lot more information there. And then health problems related, we can say again hypertension, diabetes, hyperlipidemia. Those are all relative to this diagnosis. Okay, so for that, we're just going to stick to that. And at any time during your entry, you can always click on this walk me through, and it will tell you how to go through each area here. So it's actually pretty convenient to have that. Now, in the Preclinical Manager, I'm expecting my students to include the medications here, because the most important part of a medication is all of these things listed here. So it can be kind of overwhelming for a lot of students because many patients are on multiple medications, but it is a standard expectation, and it will get easier with time. So just stick through it and, you know, be patient with it because it'll get easier. So for this one, we will say that we are going to use medications for MI, and we'll just say anticoagulants, and I don't know the classification, so we will probably, well, let's say warfarin, because they also have a DVT, and the classification is going to be anticoagulant. Of course, it's not going to be there, so what could it be? Antiplatelet, maybe? No. Bear with me. Again, I didn't prepare for this. I'm just kind of going through it like you guys would. So this is just kind of an example of what you guys would have to be going through to do this. So because I don't know off the top of my head, I am just simply going to Google it in another screen. And let's see here. All I see is anticoagulants and blood thinners. So here's coagulant. Okay, so this is a prime example of how oddly listed it is. It says blood product modifier or volume expander anticoagulant. So that would be my classification. My route, let's see, IV infusion, let's say PO because this is warfarin, that doesn't come as IV. And then for my dose, I want all of this stuff filled out. So we'll say 2.5 milligrams, and we'll say daily, and the date it was ordered, we'll say yesterday. Now, for comments and additional medication information, this is where you're going to put any additional information that's listed in the order. So it could be like holds for INR less than or greater than whatever the doctor writes. And then the therapeutic effect, then the blood, prevent blood clots, and then the range is going to be, we'll say 2.5 or 2 to whatever the doctor wants. We'll say 2 to 3. The action, so this is what the medication does in the body. So how it works in the body. Contraindications, obviously if the patient has bleeding disorders, or I don't know, if their INR is off. Just as examples. Side effects, sure, dizziness, bleeding, bruising, and then life-threatening conditions. This is where you're going to find it in your book, probably, most likely, but it's really important that you include life-threatening, because a lot of times this is a big area where students tend to miss, and this is where they like to test a lot on boards. So this is kind of important. And we're just going to Google this because I don't really know what it's going to pop up, but this is in your book. So a lot of the times they will have something that's known. Most drugs will have something that's known for every single drug. This I'm just going to say like blood loss, because I can't find anything really. And let's see here. So I think you guys get the point. For doses, then you're going to fill this in. And then for nursing interventions, this is very patient specific. So your book is going to list like a million things to put in there. And this needs to be very patient specific. So we're going to check your INR. We're going to monitor for bleeding, signs and symptoms of bleeding. And then, adjust dosage based on labs, etc. So I'm just going to leave it at that for right now. And you're going to have multiple medications. So based on the medications that you have, you're just going to continue to add them right here. And then you can save these, and if I'm not mistaken, they will continue to show up every time you use them again. So you don't have to keep going in and adding all of this stuff in. So I tell my students, do it right the first time and then it'll show up again for you later. Then you're going to go down to lab tests here, and again, this is going to be under saved if you save it. And so for your labs, this is a tricky area because this is where you learn how to panel your lab studies. So for example, your CBC is not going to be listed as a complete blood count or a comprehensive metabolic panel for a CMP. It's going to be under a panel. So your panels have multiple things included in them. So for this one, we'll just do a CBC because that's easy. And then the data test, we'll just say yesterday. And then they're going to want you to define everything that's listed in a CBC. So the panels are really nice because it breaks it down into what is included in your CBC. Now, if you chose, say, just, let's see here, blood tests, and then you did your, what was I looking for? Your INR. You would just go strictly to the INR here. And so it's not going to pop up as a panel where there's multiple things listed here because this is just your INR. So you're going to look up what your INR is for and why we order an INR. And then I kind of got off track with my MI thing, but I think you guys get the point as far as what I'm trying to show you here. So you're going to list what the INR is, why is it being ordered. So significance of the test being ordered for this patient is because the patient has a DVT and is on Coumadin, and labs are, or meds are specified based on labs. So this needs to be patient specific again. And then if your lab result is off, say it's subtherapeutic, say it's 1.0 and it's low, and the result significance is that the dose needs to be adjusted based on orders for it to be therapeutic. And I'm going to save it. Let's see if it lets me. Yes, it did. And then you're just going to keep going in and adding your labs. Diagnostics. So again, you're going to add everything in here. Let's say we did a chest x-ray for this patient, and you have to go in and kind of mess with these things and just figure out what works and what doesn't work. There are millions of different types of tests, so you kind of have to just get used to what all of them are. So I wished I could tell you an easy way to do it, but there's really not, unfortunately. But like I said, it gets easier. So we're going to just say oblique view, why is this test ordered? And we'll say ruling out other causes, or maybe we're ruling out pulmonary embolism. Sorry, it's late and I'm tired, so sorry if I'm like super boring. And then significance of the test. So obviously the patient is suspected having an MI. Patient is suspected of having MI, ruling out PE. And then if it was positive, then you would say why that's important, but we'll say this was negative in this case, just to make it quick. And then you're going to go, oh, yes, we want to save. Obviously I'm talking and there's a lot of information here. Oh, it wants the test date. So again, you can't really leave things blank, otherwise it won't let you move on. And so far this is what my preclinical manager says. So it took me about 20 minutes to talk through all of these things and then just kind of explain each section to you. But eventually it'll get easier and you have to just keep adding things as you go. I always hit generate HTML just so I can see what it looks like, because to me it makes more sense this way. You don't have to do that, but you can just go to your next section. And for this, for the sake of being easy, I'm going to stop the video so I can move to the next section of my SimChart navigation. So far, what we've done so far is this section. So info panel, where we set up our basic info, and then we set up meds, the diagnosis, labs, and then diagnostics. And I'm going to highlight this here so we can all realize what we did. And then for the next section, then I'm going to go on to the next area of what I'm expecting of my students as far as documentation goes and the remainder of SimChart.